Hey everyone, thanks so much for coming back to my YouTube channel. I'm really happy that you're here and I hope you're having a flare-free day. Today's episode I wanted to dedicate solely to some questions that you can have prepared for your doctor, GP, medical provider after your surgery for endometriosis. Now there are a couple of different types of surgery that do occur for endometriosis. There is excision versus ablation. They are very separate and there are different types of care regarding those two surgeries, and I'm sure I'll get into that at another time, but it's important to have questions prepared ahead of time so that you feel more confident and less anxious going into a meeting with your medical provider, especially after a surgery. So these are some 7 questions that you can ask after your endometriosis surgery to kind of get some insight into how your body is doing, how your body is healing, and some next steps to help in your healing journey with endometriosis. So if that interests you, then just keep on watching. Okay, so the first question that I would want to know is, did you find endometriosis lesions? Or you could frame it as, have you sent out for a biopsy to confirm endometriosis is present in my body? It's important to ensure that a biopsy was sent for testing for endometriosis or to just confirm if what you're dealing with is in fact endometriosis. So question number 1, did you find endometriosis or have you conducted a biopsy for endometriosis? The second question that I would want to know is, are my incisions healing well? So when they go in for a laparoscopic surgery, you will have incisions that are made to actually go into your body to see what's going on. So I would want to know, is there an infection present? Is there any cream that you can be providing so that I can take care of my incisions? Am I doing everything necessary? Should I be avoiding exercises to make sure that my incisions heal properly? Anything that you want to know in regards to your incision, so the cuts that are made, then it's important to make sure that you get some answers for that, because that's something that you don't want to deal with on top of, you know, some pain or discomfort from the actual surgery itself. So, are my incisions healing correctly? Question number 3, if they have answered yes to finding endometriosis in your first question, then I would ask, where did you locate endometriosis adhesions or lesions? I would want to know where they were in my body. It's my body. I want to know what's happening in there and to gain a little bit more insight as to what was causing my pain. So did you find them around my bowels? Did you find them around my kidneys? Are they growing into my diaphragm? So where in fact did you find endometriosis lesions and adhesions? The next question that I would ask are, did you excise all of the endometriosis lesions and tissue? So I'll say that again. Were you able to excise or remove all of the endometriosis lesions and tissues that were present? It's important to ask this because if they weren't able to, I would want to know why. Was it an area in my body that was hard to get to? And if that's the case, is there going to be more pain or discomfort causing some more symptoms later down the road because we didn't get to that tissue or lesion? Or is it another factor that we just didn't get to it? Was it time? Was it just a stubborn tissue or lesion to get to? And is there complications to leaving that lesion or adhesion in my body? So key things to ask, because it is important to know that, are you dealing with endometriosis still, or is it fully excised and you should be continuing in your pain management journey to just help you heal after surgery? Okay, the next question that I would ask is, what stage of endometriosis do I have? Now, this is important because there are 4 stages of endometriosis that have been reported. So it's from mild to severe. And it's important to know that what stage you have. I would want to know for sure to see if there's any more issues or complications that are related to different stages. So is my infertility impacted? You know, is there a depth of tissue that I need to be concerned about? Is there, you know, some more growth that are happening that I need to prepare for surgery again down the line? These are things that I would want to know, and that comes with the question of, what stage of endometriosis do I have? Okay, as we know, endometriosis is a full body disease. It's not just a reproductive disease that has been debunked. Endometriosis can grow in your lungs, in your brain, it can grow in your kidneys, your bowels, everywhere. It's been on every visceral organ in the human body. So something that I would want to know is there damage present on surrounding organs where you found endometriosis lesions or adhesions? This is something that I would want to know. It might be a scary question to ask because you kind of don't want to know if there's a problem. I would be like, oh, is there more issues down the line that I need to deal with? But It's important to know if there is damage to surrounding organs caused by endometriosis, or even nicks caused by surgery, because you want to know if there are steps that you should be taking, taking antibiotics to help with healing, or is there anything else that you should be doing to take care of yourself and your body? Because if there is damage to surrounding organs, it's important to know that and to ask further follow-up questions as to why do you think that is, what do you think caused that, and next steps on care. So question I would ask is, did you notice damage to surrounding organs caused by endometriosis? Finally, the question that I would want to know after asking all of those other questions is, what are the next steps that I should be taking in my pain management journey? Healing after surgery is not just a one quick fix. There's going to be ups and downs in the days leading after surgery because you have gone through a major thing. So I would want to know, are there steps that I should be taking pain management wise to help me in the healing process? Again, is there medication I should be taking? Is there exercises or stretches that I should be doing to help heal my incisions a little bit easier, or to help stretch out things after surgery? These are important questions to ask, and your doctor should be able to provide those answers. I would also recommend asking if there is a follow-up after this follow-up to see how things are improving. I would not want to just leave it at this final discussion after a post-op. I'd want to say, can we touch base again in 5 or 6 weeks, or depending on your timelines or timeframes of what you personally want, just to see if things are healing the way that they should. And if you have any other questions that didn't come up in this initial post-operation consult, you'll have the time and opportunity to do that then. So I hope that really helped. Surgery is a very scary thing, and it is a major decision that you're making for yourself and your body. Don't let anyone else pressure you to do surgery or to not do surgery. It's your body, it's your choice. You are the one that is living with the pain and discomfort every day caused by endometriosis. So at the end of the day, I can provide this advice, but it's up to you to make the decision on if you want to carry through with that. I hope that these questions have helped. And if there are any other questions that you had asked during your post-operation that might help others in their journey, feel free to pop them in the comment box below. I'm sure that they will be helpful for others in their journey, including myself. And if you're on the wait list for surgery, just know that you're not alone. And if you haven't decided on what you want to do, that's okay too. You don't have to have all the answers right now on what you want to do in your pain management journey with endometriosis. This is just a video to help where I can. And so again, pop some questions down below that helped you after post-op, and I'll talk to you on the next one.